But sugar's love. You know, Grandma's the one that makes cupcakes for the kids, right? Grandma gives you fudge and brownies. That can't be bad. You know? We have bake sales. That's how the Spanish Club makes money after school. They have a bake sale. I always say I want to come in and set up a table with alcohol and tobacco right next to it. You know? And so, you know, and everybody'd be upset and say, well, we can't do that. That's not good for them. Well, what are you doing over there, you know?
Hi, I'm Dr. Barry. Today, for the health of it, we're going to take a trip on the insulin-resistant highway. Don't worry, I'll bring you back.
Diabetes, just ahead. You notice that's front and center in the insulin resistance highway. But what's really important to understand, you don't go to bed one night with normal insulin sensitivity and healthy and wake up the next day with type 2 diabetes and sick. This is a process. It takes time, sometimes years. And if we identify it in that process where it's moved off of normal and headed toward more abnormal, if we intervene at that point, we can turn this around. This is not something that's simply preordained. The insulin resistance highway is in fact a two-way highway. This is not a one-way street. Okay? So let's talk a little bit more about this, because this is what's critical for you to understand. This is a process that can be reversed. You just have to be made aware of it and told and helped with what to do about it. Now, normal insulin sensitivity. This is when your body, the cells of your body, have a normal sensitivity to the hormone insulin. When insulin is out, telling your cells to take the blood sugar in, burn it, and store it, they do so at a normal fashion. However, as we start to accumulate more and more body fat, what happens is the cells start to become resistant to the message that insulin is giving it. As we alluded to earlier, the cells start to say, we got enough, we don't need any more. And the body has to respond by putting out more insulin to overcome the insulin resistance, the resistance of the cells to taking in and utilizing that sugar. One of the first things we may see is your fasting blood sugar. That blood sugar that you have taken so many times when they tell you not to eat after the night before, and to come in, have your blood drawn early in the morning. Maybe it's an 8 or a 10-hour fast where you don't have any food. They look at that fasting blood sugar. They draw it, and many times your doctor may say to you, well, it's starting to get up there. You know, you're starting to get a little high. It's kind of borderline. You'll hear the term borderline diabetic. That's a term that gets used a lot. And that basically is a reference, in fact, to this insulin resistance highway. This idea that you're not just normal one day, diabetic the next, that there is actually a path you must travel. However, those folks who are borderline diabetic, the reality is those are folks that have metabolic syndrome already. They're sick. The good news is, at that point, they can reverse that process. They don't have to continue on down. We said it's a two-way street. Now, impaired fasting blood glucose, like I said, your numbers are up. You're starting to develop elevated blood sugars. You're on your way. You've left normal, but you're not at diabetes. If this is allowed to progress, we move to prediabetes. Now, this is a term you're hearing more and more of. 90 million Americans live with prediabetes. 90 million. This is basically type 2 diabetes waiting room. Patients who have prediabetes, if in fact they don't start to do things to reverse the process, which they can do, they will in fact move on to develop type 2 diabetes. So very important to understand that these prediabetics, and we see patients with this in the clinic all the time. We educate them, we identify that for them, and we help them and give them the instruction on what they need to do to bring this back. And in fact, they do just that. They're able to move from pre-diabetic back to normal insulin sensitivity. And this is critical, because when they're in this stage of impaired fasting glucose or prediabetes, this insulin resistance is increasing, and it's the inflammation associated with this insulin resistance which is driving a lot of the heart disease, stroke, and diabetes risk. Now, if in fact prediabetes is either not recognized or not treated appropriately, the patient moves on to type 2 diabetes. And you can see this. Now, if you notice, this arrow is red and it's one way. At this point, it's felt that once a patient develops type 2 diabetes, most clinicians feel that that is not something that's reversible. Patients can get to a point where they may be diet controlled, not requiring any specific medications, but they'll refer to them as diet controlled diabetics and they leave them with that label. Whereas if you're pre-diabetic, or if you have this impaired fasting glucose, you notice these arrows are two-way. You can actually turn this around. How do we do it? We got to get rid of this visceral abdominal fat. Obviously, as patients become more active while they're doing this, all of this is a process, but it's something that can be unwound. As this moves forward, as I mentioned, patients that are here can move back here and ultimately back to normal insulin sensitivity, that healthy point at which your cells recognize the hormone insulin and respond to it appropriately. Now, I want to thank you for joining us. We hope to see you again next time for the health of it.